My name is Suliman Hasham from Group 27, 4th semester International Medical University. Today my presentation is Today my topic of presentation is drug affecting function of uterus. Hypothalamus regulates pituitary functions. These structures are anterior pituitary gland and posterior pituitary gland. The alpha subunit of these four human glycoprotein hormones are identical, however, their beta chains are unique and confer biological specificity. Inside the ovary are hundreds of thousands of follicles from first day of menstrual cycle. A few follicles begins to grow at the same time but stop growing around day 7 except the one. In a normal menstrual cycle, one dominant follicle will grow containing one egg. The follicle will get bigger unit it refers it evolution, which then release the egg. This is usually around 14 days after the beginning of woman menstrual cycle. The endometrium is the inner epithelial layer along with its mucous membrane of the mammalian uterus. It has a basal layer and a functional layer. The functional layer thickness and then is shed during menstruation in humans and some other mammals. Estrogen and progesterone are two hormones, follicle stimulating hormone. Progesterone converts the endometrium to its secretory stage to prepare the uterus for implantation. During implantation and gestation, progesterone affect to decrease the menstrual immune response to allow the acceptance of pregnancy. Female reproductive system. An egg is normally fertilized by a sperm cell in a fallopian tube. Within 9 days, the fertilized egg moves down the fallopian tube into the uterus. It then attaches implant to the wall of uterus. After the fertilized egg implant, the growing placenta start releasing HCG into blood. Some HCG also gets passed in urine. HCG can be found in the blood before the first menstruation period. This can be as early as 6 days after the egg. From 115 million spermatozoids, several thousand only reach the place of fertilization to fertilize the single egg. The rest of them die. During sex, a man threw from 2 to 5 milliliters sperm into vagina. First trimester, from first day to 12 week. Second trimester, from 13 week to 28 weeks. Third trimester, from 29 to 40 weeks. The placenta is a temporary fetal organ that begins developing from the blastocyst shortly after implantation. During drugs affecting function of uterus. Drugs strengthening of uterus rhythmic. Tocolytic drugs weakening uterus contraction. Posterior pituitary hormone oxytocin, ergot alkaloid, agrometarine, methyloremoutarine, prostaglandins, PGE2, PGF2, mesoferrostol, beta adrenomatics, fertilium pheneterol, antidiarrhythmic, magnesium sulfate. Oxytocin. Oxytocin is non-peptide hormone that has a central role in the regulation of parturition and location. There is oxytocin receptors signaling and its role in the myometrium during pregnancy and labor. Oxytocin works by increasing the concentration of calcium inside muscle cells that control concentration of uterus. Increase concentration of uterus. Posterior pituitary hormones name oxytocin. Parental dose 10 unit per milliliter. Half-life 1 to 6 minutes. Postpartum hemorrhage 10 unit IM after delivery of placenta, 18 to 40 unit, not to exceed 40 unit to 1000 milliliter of non-hydrating IV solution and infuse at necessary rate to control uterine atony. Labor induction 0.5 to 1 m unit per mini 4A6 tetride 1 to 2 m unit min Q15 to 60 men until concentration pattern reach that it's similar to normal labor. Usually 6 m unit per minute may decrease dose after decreased pregnancy of concentration reach and labor has progressed to 5 to 6 centimeter dilation. Incomplete or embryo absorption 10 to 20 m unit per minute, not to exceed 30 unit per 12 hours. Common side effects of oxytocin includes slow heart rate, fast heart rate, premature ventricular complex and other irregular heartbeat arrhythmias, permanent central nervous system or brain damage and death to secondary suppuration. Neonatal seizure, neonatal yellowing of skin or eyes, jaundice, fetal death, low FGAR source 5 minutes. Androplacental hypoperfusion and variable degradation of fetal heart rate indicate fetal oxygen level hypoxia. Parental hepatic necrosis, fetal hypercapnia, severe decrease in menstrual systolic and diastolic blood pressure, increases in heart rate, systemic venous return and cardiac output and arrhythmias. Posterior pituitary gland name dexaminoxytocin. It is not inactivated by oxytocin synthase and is 50 to 100 times more effective than oxytocin. 50 IU subglossal. Parental dose, no parental dose, half-life 5 hours. The recommended dosage for desaminoxytocin is 25 to 50 unit bicycle tablets every 30 minutes or is necessary. Side effects in the therapeutic doses demoxytocin does not cause clinically significant side effect. The use of demoxytocin is high doses and increased sensitivity of the uterus can lead to the following side effects in the mother. Uterine cramps also when used in low dose, uterine hypertensity, tetanic concentration, uterine hyperreactivity with uterine and vaginal tissue referral, nausea, vomiting, hypersalivation, increased blood pressure, tachycardia, arrhythmia, death is possible. There is a risk of disseminated intravascular coagulation in the fetus, bradycardia, arrhythmia, asphyxia, acute fetal hypoxia, staining of amniotic fluid with meningium, death is possible. In newborn, there may be jaundice, retinal hemorrhage. Aggregate alkaloids. Mechanism of action. Aggregate alkaloids have structure similar to the biogenic amines, norepinephrine, serotonin, and dopamine. Vasoconstriction is produced by an agonist activity and this effect varies with different vascular bed. Hyperthermia and uterine stimulation are other effects. Uses of agrometerine. Agrometerine is used in the prevention of postpartum hemorrhage. Whole. It acts as alpha-adrenergic dopaminergic and serotonin receptor. It exerts on the uterus and the other smooth muscle. Agrit alkaline agrotometerine 0.5 mg oral tablet, parental dose 0.5 mg per milliliter, half-life 30 to 120 minutes. Methyl arocometerine have no internal dose, parental dose 0.2 mg per ml for IM injection. Half-life 30 to 120 minutes. Side effect: nausea, vomiting, stomach pain, diarrhea, leg cramps, increased sweating, skin rash. Prostaglandins. Prostaglandins E2, PGE2. Prostaglandin, also known as dinoprostone, is a naturally occurring prostaglandin with excitotoxic properties that is used as medication. Dinoprotein is used in labor induction, bleeding after delivery, termination of pregnancy, and in newborn babies to keep the ducts uterus open. Mechanisms of action: dinoprostane-induced uterine concentration are similar to those produced by the body during spontaneous labor. Increase in the amplitude and pregnancy of uterine concentration reduce cervical tone, which produce cervical dilation. Prostaglandins: dinoprostane, carbobrost. Dinoprostane have internal dose 10 mg, vaginal insert, have no parental dose, half-life 2.5 to 5 minutes. Carboprostate PGF2 alpha 0.5 mg per 3 gram endocervical gel, parental dose 25 mcg 1 ml IM, half-life 2.25 to 5 minutes. Prostaglandins F2 alpha, PGF2 alpha in prostaglandin nomenclature. Pharmacology: the term carbobrost is a naturally occurring prostaglandin used in a medicine to induce labor and abortifacient. Drug strengthening of uterus rhythmic: misoprostol tablets 100 mcg 200 mcg have no parental dose, half-life 20 to 40 minutes. Induction of labor: 25 mcg 1/4 of 10 mcg oral tablet intravaginally initially when repeated, and intervals not to exceed Q3 6 hours. Not to be used in patients with previous recent delivery or major uterine surgery. Postpartum hemorrhage prophylaxis: 600 mcg PO within 1 minute of delivery. Treatment: 800 mcg PU once. Use quotation: a prophylactic dose already given and adverse effect present or observed. Treatment of incomplete abortion: 600 mg basically 1. Side effects include severe opening, stomach discomfort or diarrhea, feeling very thirsty or hot, unable to urinate, heavy sweating, and hard, dry skin. Prophylactic drugs weakening uterus: fluticasone, peneterol. Important indication for B2 adrenoceptor agonist is toconolysis with the aims to reduce premature labor and fetal mortality. B2 adrenoceptors are dominant, 80 to 85% B2 was 15 to 20% B1. Adrenoceptor in pregnant women in the uterus, especially in the progesterone dominant uterus, they mediate muscle relaxation. In addition, there appears to be a positive correlation between myometrical and B adrenoreceptor density in the litis of the pregnant woman. Drug weakening uterus concentration: fluticasone, peneterol have internal dose 5 mg tablet have no parental dose. Half-life 5 minutes. Magnesium sulfate have no internal dose. Parental dose has 40 mg per milliliter, 80 mg per milliliter, 50%. Half-life 5.2 hours. Magnesium sulfate can act as a smooth muscle relaxation, possibly by blocking calcium-mediated concentration, decreasing acetylcholine releasing from the neuromuscular joints, and reducing histamine-induced airway, which with dose of 20 and 40 microgram pentobarbital, submaximal uterine relaxation times of 7.3 and 7.9 minutes were obtained. Subjective side effects such as palpitation and restlessness. This is the prescription of a patient. His address is Bishkek City, Manas Street 10. Minestrone 800 mcg tablets, 1 tablet in a day orally.